Okay, here we go. Here is the recorded lecture for our flipped classroom Wednesday on non-pharmacological pain management during labor. Here are the objectives for the lecture that can help guide you to study for the exam. Okay, so first we're going to talk about how individuals perceive pain. One thing we know is that each person reacts differently to pain. Not two of the same people are not going to react the same to the same pain level. So we have to remember that it is subjective, that each person is going to describe their pain experience differently. They are going to perceive it differently, and they are going to respond differently. So this means that when we get to the next slide, we not only have to look at subjective information, but we also have to look at objective signs of pain, things that we can see that tell us an individual is pain. Another thing that will affect someone's perception and expression of pain is their culture. There are several cultures where individuals are expected to not express pain. And therefore, it's very important that we are attuned and we assess those objective or nonverbal signs of pain. We don't want to assume that just because somebody is not telling us they're in pain, that they are not experiencing pain. We want to be proactive in helping individuals manage their pain, especially during childbirth. Childbirth is painful. There's no other way to say it. It just is painful. And there are things that we can do to help them with their pain experience. Another thing that does affect someone's perception or pain, or not exactly their perception of, but how much pain they are willing to endure, is their desire to have a natural childbirth without any artificial management of their pain, such as pain medications and an epidural. Some women are very set in the manner that they want to experience childbirth. They want to experience everything that goes along with giving childbirth, and that means pain. And so if they have a strong desire to have a natural childbirth, then they may find ways to deal with their pain without pharmacological management. We know that childbirth preparation classes, Lamaze classes, you may hear them called, where women and their partners go to a class which explains to them what childbirth is going to be like, what to expect. They teach them ways that they can manage their pain during labor. Studies have shown that women who are educated this way have a tendency to manage their pain sometimes a little better, especially if they have practiced before coming to the hospital in labor. We also know that having a good support system during labor helps a woman manage her pain. So how she perceives it and then how she is going to relate to that pain can be greatly helped with family members who are there to support her. The RNs, the nurses that work in labor and delivery, can be a great support system, helping women deal with their pain, helping them use non-pharmacological pain management techniques. And also there is a person called a doula who can be very beneficial during the labor process. A doula is a person who has gone through some training to help women manage their labor pains non-pharmacologically. They can be a nurse, they can be a lay person. They do not have to be a healthcare provider. And they would come with the woman to the hospital during her labor, and their only role is to help the woman with non-pharmacological pain management techniques during her labor. They are not a member of the staff on the unit. They should not be used to perform duties that the staff nurse should be performing. They are strictly there in a support role for the woman in labor. Some doulas have a business where they will charge fees for this service. There sometimes are volunteer doulas. When I worked at St. Anthony's in Crown Point many years ago, they had a volunteer doula system. And so they had women on call. And when a woman came in labor, they would ask her if she wanted a doula during her labor. And if she said yes, then they would call the doula on call, and that person would come in to provide assistance with that woman during labor, managing her pain. And so there are different ways that a doula can practice, but they are not a member of the staff, and they should not act in roles such as the staff nurse. So as I mentioned previously, every woman expresses pain in different ways. They may even try not to express their pain, but we need to be aware of signs and symptoms of pain, whether they are objective, subjective, whether they are nonverbal. So naturally, this is probably just a refresher, but we know that when a person is experiencing pain, we will see changes in their vital signs. We will see their blood pressure increase, their heart rate increase, and probably their respiratory rate also increase. You can see other objective symptoms that we will be able to see manifested by a person in pain. As the pain gets very severe, they may have a pale color, start sweating, even get to the point of being nauseous and vomiting. And then, of course, you're crying, writhing, and groaning in reaction to the pain. And they also may become very anxious due to the pain if they don't know how to deal with the pain. So we're going to talk about some factors that may influence the way that a woman responds to her pain. And we know physiologically, as a woman gets tired, she may not respond to her pain in such a positive manner as before. When she first comes into labor, she may be able to tolerate her pain. She may be able to relate to it a little better. But as she becomes more tired and labor goes on, she just might not be able to deal with it as well. How strong her contractions are going to affect her response. The fetal size and position, that can affect her response because it can affect how easy her labor might go, or if her labor is going to be longer because the baby is maybe in an occiput position and it's going to take longer for the baby to travel through the birth canal, or if it's an occiput position and the baby is pressing on her sacrum. That may be factors related to her labor that may make it more difficult to deal with the pain because it is making the process longer or more painful. We also know that there is a release of natural endorphins related to the pain experience. And so sometimes these can help women relate to their pain a little better, okay? Culture, as I mentioned before, can be a big factor in how women express their pain. There is actually a box or a chart in the textbook that goes over specific cultures and how we might see those women relate. As I mentioned before, they may be stoic and may not be allowed to express their pain. They may not ask for pain meds because that is seen as a weakness. So we just have to be aware of cultural differences and still even just realize that even if a woman is not expressing her pain, is not asking for assistance with her pain, this does not mean that she is not in pain. And we should still ask her about her pain and ask her if she would like anything to help with her pain. Okay? Anxiety. Anxiety is interesting when it comes to pain. Anxiety does not increase a woman's pain. So if a woman comes into labor and she's very anxious about the whole process, this is not going to make her pain more painful. But what it is going to do is it's going to affect the way that she reacts to her pain. It increases her perception of pain. So if you have two women who are experiencing the same level of pain, and one is in an anxious state, and one is in a very calm state. The woman who is anxious is probably going to react as if her pain is greater than maybe it is, because her anxiety is affecting her perception. Okay, so we have to be aware of our women who are anxious, and we need to work with them so that we can bring down that anxiety, and that may help with her pain management and perception. Also, her previous experience is going to affect her pain response, and this may relate to her level of anxiety. If a woman is pregnant for the second time and she's coming into labor, and her first labor was very long, very painful, it wasn't the way that she thought it was going to be, she's going to bring that experience with her. And she may be anxious because she's thinking, oh my gosh, it's going to be the same. I don't want to go through that again. That was just too hard. It was too long. I don't know how I'm going to do that. Whereas if a person comes in who had a very easygoing labor, it went according to plan, there wasn't much out of the ordinary, she was able to deal with her pain, then she's going to come in a more calmer state, and she won't be anxious, and therefore hopefully her pain perception will be better, and she might be in a better place to manage her pain. So, non-pharmacological techniques that we use for pain management. These are all based on the gate control theory of pain, which I hope that you have had earlier in previous classes. As you know, the gate control is the thought that there's a limited number of sensations that can travel through a nerve pathway at one time. So, by using the gate control theory of pain, we are creating a distraction that will travel through the nerve pathway, so therefore it kind of distracts or interrupts the pain experience. So different things that can affect this are massage, music, imagery. We're going to talk about massage and imagery in a future slide. Music can be very distracting. Having a woman bring in headphones or using her phone with headphones and music can be very relaxing. The environment of the labor room can set the tone for her whole pain experience. If you've been on the unit already, probably what you've noticed about the labor rooms is that they have a more home-like setting. They have wood floors, they have pretty paint, they have their own bathroom. All of the medical or emergency equipment is hidden so that they're not seeing it and wondering what is that for and creating anxiety. Okay, so the equipment is away. We try to keep a calm atmosphere, so not have too much stimuli going at the woman at one time. Keep it relaxed, keep it calm. And we talked about the doula or the support during labor. That support may be a doula that comes in with the woman. It may be her family, her support, her significant other, a friend. It could very well be you as the nurse or the student as you do your clinicals. If she doesn't have a big support person, then as the nurse, I feel that it's your responsibility to help her manage her pain, help her get through this experience in a positive manner. Because if she can get through this, especially for first-time moms, if we can create a positive environment, a positive experience, then if she gets pregnant again and comes back in labor again, then hopefully she will come in a more calm state, and she will start calm at the beginning and not be so anxious thinking about how awful it's going to be. Okay, so it's important to provide reassurance, provide reinforcement to create that calm atmosphere. So some actual techniques that we can use. We can use water in varying degrees and techniques. We can use water as hot and cold compresses. They can be very effective during labor. Some women may prefer a warm compress. Some women may prefer a very cold compress, depending on whether they get very warm or cold during labor. Just as if when you don't feel good or you have a cold or a headache, a compress on the forehead, across the chest, even across the back of the neck can be very comforting for a woman during labor. You can see water therapy, actually getting in the shower during labor can be very relaxing. Some hospitals have even put whirlpool tubs into the bathrooms on their labor units, so even getting in a bath and just soaking and floating in the water can be very calming. And it doesn't take away the pain, but it helps put the woman in a better state of mind so that she can react to her pain better. Okay? One of the things about a bath or a shower is if we use it very early in labor, in that latent phase, and she is not in an active labor pattern yet, sometimes it can slow the process, okay? But it can be very helpful when she gets to that active or the latent phase, and we know that she's in labor and she's having some difficulties, okay? Touch and massage. Touch and massage is very helpful during labor. Sometimes women, or I shouldn't say sometimes, but women will react differently to touch and massage. Some women are very welcoming to the touch. Some women do not like to be touched during labor, or they like to be touched. It's okay to use massage and touch in the early phase, or let's say the latent phase, maybe into the active phase, but once it gets too intense and they get into really tough labor late in the active phase, especially the transition phase, some women then at that point cannot tolerate the extra stimuli and do not want to be touched. So it's important that we use touch and massage in relation to how the woman reacts to it. And if it is not effective and it's just creating more stress for her, then we should stop using it. Effleurage is a very effective touch. All that is while she's having a contraction, she can do this or someone else can do it. And I'm going to stand up for a minute, and then they just kind of go around their abdomen just like this in circles. And it's a very light touch. And we do this during the contraction. So this way she's focused on the circular touch rather than the pain. So that can be very effective. Massaging their hands, massaging their feet during contractions can be effective. Also, counter pressure. Counter pressure is used for a woman who is experiencing what we call back labor. This is when the infant is in an occiput position, so that means that the back of the baby's head is pressing on her sacrum. And with each contraction, as the contraction pushes on the baby, it's pushing on her sacrum. So what we're going to do, or we can teach the support person to do this, is they can either use their fist, or if we have like a tennis ball, while she's having a contraction, let's say this is the back of her, this is her back, this is her sacrum. During that contraction, we're going to take our fist or that ball and apply counter pressure. And that can be very effective in helping manage back labor pain for a woman whose baby is in an occiput position. Okay? Other very simple relaxation techniques that can be used during labor are distraction and imagery. Distraction is during a contraction, we want the woman to focus on an object. So if she took a childbirth class, they may suggest that she bring some little object of meaning from home with her. If she did not, then we can just pick something in the room. Maybe there's a picture on the wall or something like that. So we would take this little object and put it somewhere, maybe on the bedside table, okay? And then every time she has a contraction, we just want her to focus on that object. Maybe think about, where did she get it from? Who gave it to her? What meaning does it have for her? What memories does it bring up? And so she's thinking of that during the contraction. We can also have her use imagery. where she just kind of closes her eyes and she thinks about being somewhere else. It could be a vacation that she went on. It can be a favorite place of hers, but it's somewhere not here in the hospital. And once again, it's hopefully taking her mind away from the pain of the contractions. Okay? And then, of course, we have all heard about breathing techniques used during labor. They can be very effective if done correctly. So the next slide actually has the different patterns that are used, and there is a video on Blackboard that you can watch and listen to demonstrate the breathing techniques. One of the key things using breathing techniques is there should always be a beginning breath and an ending breath. So when she first feels the contraction starting, she should take a deep breath in and then go into whatever breathing pattern she's using at that point. When the contraction is over, another deep breath in and out. Okay? You'll see on the next slide there are different rates of breathing with each pattern. The key thing is that at the beginning of labor, when it's mild, she should use a very slow breathing pattern. And you'll see that it's not that many breaths per minute, maybe kind of like a meditation or a yoga pattern of breathing, very slow. As her labor progresses and becomes more intense, then her breathing pattern will become increased in rate and how she breathes. Okay, so that's really the key. If she's in the transition phase and she's having some very intense contractions and feeling that urge to push, a very slow breathing pattern that she would use in the latent phase is not going to be effective at that point. Okay? The other thing we have to watch out for is if she's breathing too fast. Sometimes women can get very caught up in the pain and they start to just breathe too fast. And then they can hyperventilate, which is not good because that's affecting oxygenation to her and her infant. So we need to be able to recognize if a woman is starting to ventilate. So symptoms of hyperventilation would be that she's complaining that she's dizzy, lightheaded. Another symptom of hyperventilation is she might tell you that she has tingling in her fingers. Okay? What we need her to do is we need to correct that, and basically we do that by having her rebreathe CO2 to get that balance back in check. So if you've heard people breathing into a paper bag, okay, you give them a paper bag and you go over their mouth and they breathe in and out. Well, you might not have a paper bag in the labor room, okay? What can be just as effective if they take their hands and kind of cup them over their mouth and their nose, and so that there's no openings or gaps, and then they breathe into their hands. And so then they're breathing into their hands and they're taking back that same CO2. So that can help reestablish a normal breathing pattern and eliminate the hyperventilation. So here you can see that these are the different patterns of breathing during labor. Where did I go? There we go. The cleansing breath should begin at there should be one at the beginning of the contraction and one at the end of the contraction. Slow-paced breathing, you can see, is maybe 8 breaths per minute. So this is more like a relaxation type of meditation type breathing. And then as their pain becomes more severe, maybe the active phase, then you can see that they're breathing much quicker. And then when we get to the transition phase and they are feeling that pressure to push and we don't want them to push, then we're going to start to add some pant blow and some panting, which is more distraction to hopefully distract them from the urge of pushing. But like I said before, the key is early labor, they start with a slow breathing pattern. As their labor intensifies, then their breathing pattern becomes faster to match the intensity of the contractions. Okay? And as I said, there is a nice video on Blackboard that will take you through some of these breathing patterns. And that is the end of the recorded lecture for class on Wednesday. So That's it. Bye.